Okie dokie. Looks like we are live. Perfect. Thank you everyone for joining. There we go. Thank you everyone for joining today's live stream. I'm very excited to welcome you to a conversation around supplements at work and building protocols your patients can trust. Today we're joined by Emmy Dickerson, founder of Key to Wellness Direct Primary Care, based in Panama City, Florida, and Laura Zacharia. She is a integrative pharmacist and professor specializing in functional medicine and personal nutrition. She joins us from the Fullscript team, and we're just going to be talking a little bit about how folks are utilizing Fullscript to run their DPC practice and building that protocol and process into what they're doing. We've got an expert in Emmy, someone who's been doing it now for a few years. And before we dive into that, just to kind of remind everyone about this relationship and partnership. What we've been doing here at Hint, in April, we launched our marketplace, and this is really a place where you can plug in all of your different apps to help run your practice and partner with or find the solutions that you already work with. So whether it's a new solution that you want to bring to the marketplace or one that's tried and true, like Fullscript, you can always reach out to the Hint team and start to find a way for us to pull that into your workflows and make it an even better experience for you and your folks joining. So to kick things off, I'll go ahead and allow Laura and Emmy to just quickly introduce themselves again, and then we'll jump into some learnings about how Emmy's using the tools.
All right, well, I guess I'll start off. I'm Emmy Dickerson. I'm the owner of Key to Wellness Direct Primary Care, established in 2023 in Panama City, Florida. And there we also specialize in functional medicine as well as bioidentical hormone replacement therapy.
And Laura Zacharia, I am an integrative pharmacist. I'm also a nutritionist. I spent most of my career in retail pharmacy and clinical pharmacy work before transitioning over into integrative by getting my master's in nutrition and then teaching other clinicians how to apply nutrition as well as nutraceuticals within their clinical practice.
Perfect. Well, I'll kick off the first kind of like question. I think this is a good one for both of you to kind of think through and answer. We'll start with Emmy to answer the question, but I guess as we start to think about supplements and utilizing them in your practice, why is supplement quality kind of a foundation, and what makes supplement recommendation clinically credible? Can you talk a little bit about that experience, Emmy and Laura?
Sure. Yeah, that's a great question. Credibility means everything in what we do as far as healthcare providers. I tell you, third-party testing is almost non-negotiable. I need to know that it's a quality supplement, and my patients need to know that as well. I get a lot of people that come in from Walmart with their stacks of nature-made supplements. And although they kind of do a little bit of the job, the bioavailability is not there. The formulation might not be the correct one. Case in point, magnesium glycinate versus magnesium oxide. People with MTHFR mutations, they need different formulations. So, there are so many things that go into making a foundational supplement quality and appropriate. And Fullscript actually helps with that decision process, the vetting process, because I'm the vetter. And if my patients trust me, there's a certain trust factor. And with Fullscript, I don't have to worry about whether the supplement is quality or not.
Laura, can you tell us a little bit about the third-party testing and how you respond to that?
Absolutely. I mean, you have a million things on your plate running a practice. So sitting there and going through stacks and stacks of paper, looking at third-party testing and quality and ingredients, and then reviewing the research and which dose and duration do I have to use. That's a lot for most clinicians to have to do on a day-to-day basis. So I think of quality as multiple levels. Baseline is, does the ingredient match what the label says? Are they the same thing, what it purports to say, or is there an ingredient in there that's not supposed to be in there? Second would be, what is the dose or what is the concentration of that ingredient? Does it match what the literature says is the effective dose? Next would be the bioavailability. Is it in a format that the body can actually use? You gave a great example of the glycinate versus oxide, for example. Another good example would be turmeric that comes in like 100 different formulas, phospholipids, water soluble, base, whole herb, different trademark formulas that have different bioavailability. And then, of course, how is it being transported? Because if I put a fish oil on a truck that's hitting 110 degrees in the Arizona sun, that is going to have a quality and safety impact on that formula as well, if that's not temperature controlled. Same in the warehouse where it's sitting, where it's living, and same how long it's sitting on somebody's doorstep before they're able to bring it back inside into the air conditioning. So all of these different steps have to be taken into consideration. And so before we dismiss and say, well, supplements don't work, or, supplements are just expensive pee, or we say that, hey, we don't really have any research or any safety data, that's first, let's level set and all agree that safety data exists. We have a lot of clinical research actually about the effectiveness and the safety of supplements. And the hard part is curating all that in your busy day to figure out what brand of the hundreds of brands that are out there are going to be the safest, most effective, chasing down the third-party data from them, figuring out which dose matches which clinical efficacy that you're looking for. From my perspective, we want to make sure that you are dedicated to being fully available and present with your patients in that encounter, not necessarily having to chase down all those things. So that's where I feel like Fullscript's team comes in, our quality assurance programs comes in, our clinical science liaisons come in to help take that burden off so that you could do what you love.
Mm-hmm. I mean, so, it sounds, as it's very clear to us that Fullscript is doing a lot of the work behind the scenes to make sure that we have a quality product and that you're getting the right product at the right time in the ways that she explained. Thinking back to how those protocols roll into your practice now. So can you share us a little bit about like what you do on your practice side to make sure that, you're utilizing them the right way, practicing sustainable kind of approach to this protocol? Maybe for you, yeah, sorry, that's question. Can you talk to us a little bit about your process in that sense?
Yeah, sure. So I'm a firm believer in you don't need 500 products to make your formulary tight. 80% of patients need probably 15 to 25 evidence-based products. If you go back and look at your prescribing habits or your recommending habits, you can nail it down to 15 products. And so if you curate once and use consistently, you're good to go. This is what I do. If I have patients that have PCOS, they already have a total protocol that I've built for them. If I have a patient that has high cholesterol, their protocol is already built. I'm not interested in reinventing the wheel over and over again. We have Fullscripts at our disposal because it helps to put the lean in the process. So I would be remiss to go back and add more steps by adding more supplements and trying to reinvent the wheel for every patient. So, there's scenarios surrounding metabolic health, thyroid support, inflammation, prenatal care. And I already have those things built out to decrease some of the friction. Also, integrating it into my workflow has been phenomenal. The recommendation should happen naturally in the visit, not as a separate process. Quick note in your EHR, a template sent through Fullscript, and the job is done. I let the platform handle the logistics to include the fulfillment, the reminders, the refills, and the patient communication. I'm not managing inventory. I'm not chasing down orders or any of that. My patients don't have to ask me, where do I go buy this? It's all right there in the marketplace for them. So as far as my workflow, it has been phenomenal to just simply be able to weave that right into the plan of care for my patient at the point of care.
That's great. And when you think about kind of the recommendations that are being made, Laura, like from a kind of a clinical pharmacology perspective, how do you influence that inside of Fullscript? Can you talk a little bit more about what that looks like? And then Emmy, on your side as well, when you're looking for these specific tools or the specific supplements?
I think something that Emmy said is kind of genius, where you've done the work in advance. It's like build it once, use it over and over to create a process. And so what you've done is you've identified the category, and okay, in my PCOS patients, I'm going to choose XYZ. That's going to be my baseline. 90% of the time, you're just going to hit send, and that's going to be great. It's the same way that if you're a prescriber and you're prescribing medications, you do the same thing. You have your favorite pharmacological intervention for a category. You have a starting dose that you usually go with. You might make adjustments based on various factors, but for the most part, you have a starting point, and then you make adjustments from there, additions, changes. You might run an interaction screening before you send it out, but more or less you have that process in place, which removes the friction from that recommendation. What we're trying to do is kind of replicate that for the nutraceutical piece, reduce the number of questions that are going to come up after the visit. You tell them, go get a turmeric, and they go to Costco or wherever, and they're going to look at the shelf with 100 different turmerics, and they're going to be messaging you in the portal, which turmeric did you want me to get? Or what do you think of this one? Or should I also get this omega-3, right? Like, and all of a sudden it opens up the floodgates for them picking up some other things where you may not have even had that intention. Or maybe it says turmeric on the label, but they've also included another ingredient, and maybe that ingredient they shouldn't be taking for some reason or another. So now it's even creating a safety concern. So this is a way to sort of contain some of that by having a process from the beginning. You know that it's going to capture most of your patients. And then should you want to make any adjustments from that baseline, you modulate that, you shift that prescription, you make that recommendation different for that individual. So example of that would be like, I've got patients who don't like taking pills. Having a giant like fish oil is going to be, forget it. I'm not going to take it. They're not going to be adherent with that. So now I might have to switch it to a liquid. Guess what? Quick switch, something that's equivalent. I could see what the dose is. I already know what my effective dose is because I've already set that up. I know what my target therapeutic dose is, and I can make that quick recommendation without having to then go search and Google and look for whatever else is available, or trust that the patient will be able to figure it out on their own. So I think having those systems in place ahead of time is really helpful. I think you start with knowing who your patients are, who's the top category of people that, one, you know, that a nutraceutical is going to be effective for them. I think of my metabolic patients, gut health patients, folks with like sleep, circadian rhythm disruptions. And those are the categories that you see every day that you know there is an effective intervention. There's an evidence-based intervention or ingredient that you could utilize with that population. Then the second layer is, who are they as an individual? Are they a person that wants to take a supplement? Mm-hmm. Are they a person that if I add, so it's one of my first screening questions with patients is, if I asked you to take a supplement, scale of 1 to 10, how consistent do you think you'd be with that supplement, right? Because if they're not a person who likes to take supplements, I'm certainly not going to give them a long list of supplements, and I might have to reconsider, think about the dosage. I might piggyback it on something. I might do like a powder that they can mix into their smoothie, for example, or something they could toss into their oatmeal versus having them take another pill that they don't want to take. So understanding who you're recommending for, and then piggybacking that into your process, I think not only helps you narrow down your decisions from the prescribing end, but also cuts back on some of the red tape or some of the questions or the follow-ups that happened after the fact too.
I mean, is that how you're seeing it take place in practice?
Oh yeah. Laura made a great point, because here's the thing. The best supplement is the one that the patient will actually use. I mean, seriously, we can make all these recommendations in the world, but if they're not right, tight, and curated for the patient in front of you, none of that matters. I have pre-built templates, but it's just like she said, if they're like, I don't want to take anything 4 times a day, I don't care how important it is, I've got to pivot. But yeah, it absolutely depends on your patient.
And it helps build trust, right? They want to know that you heard them. Most patients are coming to integrative practitioners or coming to us because we're listening, right? They know that they feel heard, they feel seen, and they feel safe. So if I turn around and I send them home with this long list of supplements that don't work for them, or they're going to cost more than their budget allows, that's not better. We're not making this process better. We're adding more stress. We're potentially then causing harm because they're not going to trust us and they don't think that we're really listening. So I think it's really important that the two pair together. And as you're making those recommendations, again, set the foundation. What is your usual starting point? And then from there, you can make adjustments to personalize and customize. So we're both reducing friction, improving efficacy, and continuing to build trust with our patients.
So, I mean, question for you, kind of from the DBC, clinician perspective, and let's a little bit take a step back. Let's say you're thinking about adding, the offering of supplements to your practice, or there's something new to you. As you start to build the kind of trust with your different patients, and they understand, they see the outcomes, and then the revenue starts to follow from like the business perspective. How do you think about like turning that into more of a recurring revenue opportunity for your practice without it feeling transactional for the patient?
So one of the things that I said earlier is that anytime you're making a recommendation, you're writing a prescription, flat out. Nobody blinks an eye when a physician or a nurse practitioner writes a prescription for a known medical condition such as diabetes or hypertension.
Correct.
But people fail to know that supplements and nutraceuticals are prescriptions. So it becomes a natural progression to just offer the prescription at the end of the visit or during the visit. Listen, this is part of your treatment plan. It no longer becomes I'm selling you something. It becomes I'm treating you. So to me, because I have a background in insurance sales, little known fact about me.
Okay.
And I always said, I'm a clinician. I don't like to sell things. But honestly, the sale comes as a byproduct of the education. If I'm teaching my patient why they need these things, and then Fullscript turns around and backs up the scripting when you email them with their recommendation, what it's for, what the ingredients are, you've come full circle with making a recommendation that your patient trusts. So the cost is no longer an issue. It becomes, okay, where do I pay?
Yeah.
Love that. And just out of curiosity, maybe a little tangent here for a second, but when you are introducing patients to platform Fullscript for the first time, can you talk to me a little about that process? Like, I imagine most of them haven't heard of Fullscript in the beginning, right? And so this is a new thing that they're getting an email, they're logging into. Can you talk to us about the patient journey a bit, and how you position that?
Yeah, sure. So initially, at the beginning of every direct primary care visit, when I'm onboarding a patient, I let them know the first few days, weeks will be high touch and high tech. As a result, you will be receiving your welcome package. You'll be receiving your Manifest RX welcome. You'll be receiving your Fullscript welcome. And it's all going to come within the same week. So it's really all about setting expectations, because in 2026, practices are pretty high tech. And a lot of people need to know what they have to expect, where to look in spam messages should something fall in there. So what I do is I actually tell them up front, you will be expecting an email or a text message from Fullscript. And the lovely thing about Fullscript is they also send a text message. And the conversion rate with text messages is significantly higher because everyone always has their phone in their hand. So I suggest when it says, would you like to send this out via text and email? The answer is yes. Normally they convert, they go ahead and order their supplements, and it is a no-brainer for them.
Easy checkout process, absolutely.
Mm-hmm.
Laura, anything you want to add on there based on kind of your experience?
Yeah, it's interesting. So I work with a lot of pharmacy retailers, making recommendations on how to make this process of supplement recommendations more efficient. And it's interesting. I think that having a inventory, and it's not necessarily unique to pharmacies. I know a lot of primary care practices that also like to have products on hand. And the idea of having sort of a product and something to hand somebody at the end of the visit just feels like they're getting something. They just paid for it. They're walking out product in hand, and they can initiate that much faster because now that it's fresh in their mind, they can start that habit right away. And there's something to be said about that. And if your practice has the ability to have, some key ingredients on the shelf and ready to go, I think that makes a lot of sense. But when it comes to managing inventory, you've got to manage inventory. So how much does that take to go through the stock, make sure everything is not expired, make sure that, you're ordering the correct products, that you're not potentially over ordering or under ordering or out of stock on something. So kind of taking that out of the equation, taking a moment to sort of appreciate that fact about retail, we're taking that out of the picture and making it that much more streamlined. Now, that means when you go and make that recommendation, you could be really specific on the kind of recommendation that you're making. You don't have to be beholden to what you have in stock if you need to personalize it more. So I think that's that piece. I think it's really smart to add the text piece because, yes, conversion, in fact, is higher on text. I am a perfect example of that. If you text me, I'm much more likely to follow through than if you try to email me, because my inbox is an absolute mess. So I can totally relate with our patients on that. So that in and of itself is an easy way to kind of streamline that communication. In my practice, it's virtual. So the option of having something on in my clinic it's not an option for me. Everything I'm going to do is going to then be virtual. So I have a small concierge consulting practice. I see patients and I make recommendations using Fullscript myself. So in my practice, I usually will I do the same thing. I introduce Fullscript ahead of time. I then also in the conversation will reiterate it in the conversation with the patient. And then I immediately after that session create their Fullscript account. If I can send their recommendations right away, sometimes, you're working on your notes, it might take you a minute, but I try to send it right away so that they immediately get that recognition from the conversation we just had about the supplements to the platform, so that they're in the platform, they can sort of get in there and they can get started. Another option that you have on the platform is to offer a discount to your patients. This can serve two ways. One, you can offer a first-time discount, which could be a nice courtesy, might be a great way to introduce them to the platform. And so that might be a nice way to kind of remove some of that friction of that first order that's being placed. Two, you might work with a population that might be, that might have some financial difficulties, or they might have shared with you that their budget is tight or how much they're able to spend on something. So being able to adjust that discounted rate is up to your discretion. You absolutely can charge 100% of retail, but you have the option to discount them up to 35% if you choose to. To me, I think that really makes it personal, because not only can you meet the needs of that patient, but for clinicians who are not used to a retail setting, who might feel like making a recommendation feels salesy, it might be a way to make you feel more comfortable and confident about the recommendations. You might also be looking at prices and say, wow, that's a lot for a fish oil. That's really expensive for XYZ ingredient. And it might be a way for that to feel a little bit more in budget for the patients that you're working with. So it's just another way to sort of reduce not only the administrative burden, to improve conversion, improve adherence, and also meet your patients where they're at, both from a clinical perspective, but also from a financial perspective, if that's needed as well.
All right. Cool. So we're going to be coming down to the last few minutes, and just to let folks know that are on the call, if you have any questions, you can chat them in. Sorry, I didn't mention that earlier via the comments. So last question I kind of have for both of you, actually, we'll start with Emmy. You've been doing this for quite some time, I think almost 3 years now. And, there may be a lot of DPCs that are just thinking about starting to add nutraceuticals and supplements to their practice. Were there any, mistakes that you made early on that you would just want to highlight for folks and say, try to stay clear of that one, or any advice that you give them as well?
Yeah. One of the biggest mistakes that I used to make when I first started was picking products based on margin and not merit. I would pick a very expensive hoity-toity line because I was struggling to make money and struggling to make ends meet. But I was justifying it by saying, well, it's still a quality product. But that's not the answer. And we all know that we have to meet patients where they are. And Laura just spoke on, this patient might not be able to pay for this. And so as a direct primary care provider, as we're trying to keep these things lean, we also have to keep things lean for our patient. That's the heart and core of what DPC is. So that was a little bit of a learning lesson for me. Also, Laura mentioned another thing is ignoring drug supplement reactions. I cannot stress that enough. Case in point, patients on blood thinners and turmeric and curcumin, you have got to pay attention to drug supplement reactions. Supplements are drugs. And that's what I tell new nurse practitioners. That's what I tell patients. Just because something is on the vitamin Al does not mean it won't kill you. So I would strongly say pay super duper high amounts of attention to drug supplement reactions, and then recommending too many supplements at once. I think we all start off doing that. We want to fix all the things and we want to fix them all right now. So what I have learned is that, we're going to start with 1 to 3 targeted supplements. We're going to aim at the things that make the patient most uncomfortable, make the patient most sick, the low-hanging fruit. We're going to start with those things first because number one, it doesn't overwhelm financially and it doesn't overwhelm psychologically. We want to start with 2 to 3 targeted supplements. And then if we want to, after we've reached that clinical goal, we can come back once the foundation is working and we can add more things. By then, the patient's more engaged, the baseline issues have been solved, and they're not as overwhelmed. And then no follow-up. Please follow up with your patients. When you start on a supplement, my God, if you start D, please recheck the vitamin D level. I cannot stress that enough. You know, there's one thing to show your patient what they need, but to show them how well it's worked builds the trust factor. And let me tell you, it is so rewarding to see when it's working. Those were my biggest mistakes.
I want to piggyback and double down on your point about making sure that something is working first and foremost. I made the same mistake. I would give this long list of supplements because I'd be so excited to see the results, but I would basically give them so many different things that I didn't even know what was working in that moment. So building slowly, starting low and slow, and working in more supplements as needed is really helpful because you can kind of get rid of the things that aren't working or aren't needed anymore because we've resolved that issue, or you could build and add synergistic benefits if needed. So it helps you really start with a solid foundation. So couldn't agree more with more is not better, be targeted, be specific. And 2, my kind of pro tip is pick something that has some tangible benefit. We've heard of SMART goals, like we want to give our patients when we make lifestyle recommendations, SMART goals, things that are measurable, specific, and time bound. Same thing with our supplement recommendations. They should also be SMART, meaning that if I'm going to give them, I'll use your vitamin D example, Emmy. If I'm going to say vitamin D, I'm going to say vitamin D for 3 months or 6 months, and I'm going to retest at this point to ensure that the dose that I gave you is effective and is actually increasing your vitamin D the way that I want it to be working. It doesn't matter what it is. It could be maybe it's pain that you want to address first, or you're working on anti-inflammatories and you suggest an omega-3 and a turmeric, right? Or maybe it is you're trying to get their insulin sensitivity to improve. And so you're monitoring them with either a fasting blood sugar, an A1C, or a CGM for that matter, right? Something that is tangible, that they can see the benefit and the outcome of the consistency of taking that supplement every day is not only going to build on that confidence factor that we were talking about before, but it's also going to give them a tangible reason to keep investing, not only in your relationship, but in the supplement potentially. And that's going to help with adherence for any other recommendations that you make, including those diet and lifestyle recommendations that we know always sit at the foundation.
Yep.
Perfect. Well, we are coming to the final minute here. So any just final thoughts you'd like to share as we kind of wrap things up?
I would just say that, you know, Fullscript has made an amazing difference in my workflow. I tell you, the ability to be able to just seamlessly recommend things, particularly supplements and inside the HINT environment has been, I can't say enough. The integration by itself creates a much more streamlined workflow. And I can honestly say that the choosing of the supplements has been reduced. I know the time I take to choose them has been reduced by at least 50% because it's already there. It's ready to go. The patient has it in their hand and we can continue with our treatment. So I have nothing but wonderful things to say.
Amazing. Well, Emmy, thanks so much for joining us today, sharing your experience and talking a little bit about how folks can utilize Fullscript in their practice. Laura, thank you again for taking time out of your busy weekend at the start. I wish you both have a great Independence Day holiday this week, and I look forward to seeing you on the next one.
Thank you.
Thanks for having us.